Have you ever wondered why some of the simplest, most effective health cures are practically never discussed? Why is it that a simple substance lying quietly in your kitchen, such as baking soda, rarely makes headlines for its health-transforming potential? Here is the unpleasant truth. Simple, natural solutions do not yield large profits. And when a simple cure like baking soda water can assist with digestion, inflammation, joint discomfort, and sleep, you have to wonder why it isn't more widely known. Consider this. About 350 million individuals globally suffer from inflammatory diseases such as arthritis, intestinal problems, and acid reflux. Millions more suffer from poor sleep, chronic exhaustion, and kidney difficulties. Could something as simple as baking soda water provide significant relief? In this video, we look at the scientifically proven health advantages of drinking baking soda water at night. And believe me, some of these may utterly surprise you. But here's the kicker. At the end of this video, we will show you how to properly make baking soda water, weigh how much to take safely without jeopardizing your health, and how long to utilize it until you start seeing genuine results. So don't just move ahead. Watch till the finish, because how you use it makes all the difference. Leave a comment below and let us know where you're watching from. We appreciate seeing how far our natural health community has come. And if you're new here, welcome aboard. Hit the like button and subscribe, because your journey to greater health begins right now. Let's get to it. Just a reminder that the information in this video is intended to be educational only and should not be used as a substitute for professional medical advice. Every detail published here has been confirmed by competent researchers, and all sources are supplied in the explanation. Okay, let's get straight into the amazing health advantages of drinking baking soda water at night. Begin with number 1. It relieves nocturnal heartburn and acid reflux when resting in bed. The familiar burn crawls up the chest, a nightly occurrence for many people suffering from acid reflux. This discomfort occurs when stomach acid enters the esophagus, usually owing to a weaker, lower esophageal sphincter. While lifestyle changes, such as elevating the bed's head or avoiding late meals, can be beneficial, some people seek immediate relief. Sodium bicarbonate, sometimes known as baking soda, provides a rapid remedy. Its alkaline composition neutralizes excess stomach acid, temporarily relieving heartburn. Interestingly, a 2022 study appeared in BMJ Open Gastroenterology. Investigate the effects of bicarbonate-containing mineral water on heartburn. The randomized controlled experiment discovered that participants who drank this mineral water experienced greater improvement from heartburn symptoms compared to those who received a placebo. This shows that natural bicarbonate sources may be beneficial in treating acid reflux. While these solutions may provide temporary relief, it is critical to consult a healthcare expert if symptoms persist. Chronic acid reflux may be indicative of underlying diseases such as gastroesophageal reflux disease. When requiring thorough therapy, always proceed with caution and under medical supervision. Number 2. Minimizes muscle soreness. It is late. The gym session from earlier lingers, with tight quads, stiff hamstrings, and a dull ache in the shoulders for anyone who has pushed themselves. The familiar ache can be both a badge of glory and a source of discomfort. But what if the bedtime regimen contained something unexpected, like a pinch of a common culinary staple? Sodium bicarbonate, which is well known for its role in baking, serves a completely distinct role in muscle physiology. After high-intensity exercise, our muscles are inundated with hydrogen ions, lowering the pH and making the surroundings acidic. This change dramatically increases muscle fatigue and pain. Sodium bicarbonate functions as a buffering agent, helping to counteract the acidity, and recent study indicates that it can help speed up recovery. A 2019 study published in the journal Frontiers in Nutrition found that sodium bicarbonate supplementation promoted recovery by correcting the body's acid-base balance. Following intensive workouts, the researchers found that ingesting it during the recovery window increased blood bicarbonate concentration and pH, creating a more conducive environment for muscular repair between exercise bounces. It wasn't simply about relieving discomfort. It may have prepared the body to perform better in later sessions. So, while a warm shower and stretching can help, there's intriguing science emerging about how the body recovers, and it can begin with something as simple as a teaspoon of bicarbonate before bed. Next, number 3 promotes renal function. Nighttime provides a unique chance for the body to participate in restorative processes, as well as for people who are managing chronic kidney disease, CKD. This period can be especially effective when accompanied by suitable interventions. One such technique is the administration of sodium bicarbonate to rectify metabolic acidosis, a major consequence of chronic kidney disease. Metabolic acidosis occurs when the kidneys are unable to excrete enough acid or conserve enough base, resulting in an imbalance that can hasten the progression of CKD. By correcting this imbalance, sodium bicarbonate helps to stabilize the body's internal environment, potentially slowing kidney function decline. A complete meta-analysis was published in 2021. In Frontiers in Pharmacology, researchers investigate the effects of oral sodium bicarbonate on CKD patients. The researchers discovered that sodium bicarbonate supplementation dramatically boosted serum bicarbonate levels while slowing the reduction in estimated glomerular filtration rate, a vital measure of kidney function. Furthermore, it reported increases in vascular endothelial function, which is critical for cardiovascular health, a common issue for CKD patients. Incorporating these interventions at night, when the body's natural tendency is to heal and regenerate, may improve their effectiveness. However, such treatments must be administered under medical supervision in order to customize them to individual needs and minimize potential consequences. Next, number 4. Help with gout symptoms. Imagine lying in bed with your big toe throbbing with pain that seems like it's on fire. That is the harsh truth of a gout flare, which frequently strikes at night, taking both sleep and peace. Gout. Arthritis is caused by the accumulation of uric acid crystals in joints, which causes sudden and intense pain. Consider a simple combination common in many kitchens. Sodium bicarbonate is coupled with benz-bra-marone, a medicine that enhances uric acid excretion. It has demonstrated promise in treating gout symptoms. A 2024 study, published in the British Journal of Hospital Medicine, examined this combo treatment. Patients who received both treatments had significantly lower serum uric acid levels and fewer TOFI, uric acid crystal formations, improved kidney function compared to individuals who only received sodium bicarbonate. Importantly, the combination was well tolerated, with no noticeable increase in side effects. The mechanism is straightforward. Sodium bicarbonate alkalizes urine, increasing uric acid solubility and facilitating excretion. This procedure helps to inhibit the production of new uric acid crystals and may help dissolve existing ones. Benbomarone helps the kidneys remove uric acid. However, it is critical to pursue this treatment under medical supervision. Excessive sodium bicarbonate consumption can result in metabolic alkalosis, a dangerous illness marked by high blood pH values. As a result, while combination therapy has potential, it must be used carefully. Next, number 5. After a long day, it helps to balance the pH in the body. The body's internal chemistry reflects the cumulative impacts of stress, food, and exercise. This can cause a mild acidification of the body's internal environment. Maintaining a regulated pH is critical for proper cellular function, and the body uses a variety of processes to achieve this balance. One such technique uses bicarbonate ions as buffers to counteract excess acids. A recent study published in the Journal of Nutritional Biochemistry in 2024 investigated the effect of drinking bicarbonate-rich mineral water on acid-base balance. Participants who drank 1.5 to 2 liters of this mineral water daily showed a significant increase in urine pH and a decrease in net acid excretion. indicating a shift toward a more alkaline internal environment. This study emphasizes the importance of bicarbonate, a naturally occurring chemical found in certain mineral waters that aids in pH balance in the body. Such water can help the body's buffering processes by supplying an external source of bicarbonate, especially during times of high acidity. It's worth noting that, while the body has strong systems in place to maintain pH balance, dietary choices can have an impact on these processes. Incorporating bicarbonate-rich mineral water may provide further support, especially for people who consume a lot of acidic foods. However, this must be approached as a complementary technique rather than a primary answer. The sixth step is to manage a urinary tract infection. As the day's hustle dies down in the evening, the discomfort of a urinary tract infection, or UTI, can worsen, interfering with rest and relaxation. In such cases, several people choose natural therapies to relieve discomfort. One such therapy is sodium bicarbonate. The nature of UTIs provides the basis for this strategy. These diseases thrive in acidic conditions, which contributes to the burning sensation during urine. The urine pH can be raised by adding an alkaline chemical, such as sodium bicarbonate, potentially making the environment less favorable for bacteria and lowering discomfort. In a study published in the International Urogynecology Journal, researchers gave oral sodium bicarbonate to female patients who had lower urinary tract symptoms. Over 4 weeks, individuals observed a significant increase in urine pH from an average of 5.31 to 7.2, also known as LUTs, acidic urine pH. This alkalization was associated with significant reductions in urine frequency, urgency, and nocturia. The study found that oral sodium bicarbonate could be beneficial. Low-risk method for treating LUTs caused by acidic urine. However, approach this remedy with caution. Excessive use of sodium bicarbonate can cause major health problems such as electrolyte imbalances and alkalosis. As a result, anyone seeking this treatment should speak with a healthcare practitioner to confirm it is appropriate for their particular case. Next, number 7 protects against cancer during the calm hours of the night, when the world pauses. Some people try unusual measures to improve their health. One such approach includes the use of sodium bicarbonate, also known as baking soda. While it is well known for its home usage, recent scientific research has focused on its possible involvement in cancer therapy. A 2024 study, published in Frontiers in Oncology, looked at the impact of sodium bicarbonate on tumor acidity. The study found that injecting sodium bicarbonate helped neutralize the acidic environment around tumors, potentially slowing cancer progression. In instance, the study found that mice with tumors as assets, when treated with sodium bicarbonate solutions, patients with a cancer-related fluid accumulation had higher survival rates than those in control groups. Furthermore, a case report in the paper described a patient with chemotherapy-resistant ovarian cancer who saw a significant drop in tumor markers and acidic fluid after undergoing sodium bicarbonate medication. These findings imply that sodium bicarbonate may alter the tumor microenvironment, making it less conducive to cancer cell survival and growth. However, it is important to emphasize that these investigations are exploratory and extensive. Clinical trials are required to properly understand the implications and safety of these medicines. Individuals should always contact with a healthcare practitioner before contemplating alternative remedies. The 8th step is to treat rheumatoid arthritis symptoms after a long day of battling the constant discomfort in her joints. Maria discovered consolation in a simple evening ritual. She would add a small amount of baking soda to a glass of water and drink it before bed. This exercise, amazingly, provided her with relief from the chronic inflammation produced by rheumatoid arthritis. Maria's experience is based on the immune system's response. Rheumatoid arthritis is caused by an overactive immune system that mistakenly assaults healthy joint structures. This leads to inflammation and pain, A study published in the Journal of Immunology investigated how oral sodium bicarbonate could affect immunological function. Researchers discovered that ingesting baking soda caused a shift in the spleen's macrophage population from pro-inflammatory M1 cells to anti-inflammatory M2 cells. This modification shows that baking soda can help to create an anti-inflammatory milieu in the body. For Maria, this meant fewer flare-ups and more restful nights. While baking soda is not a cure for rheumatoid arthritis, its ability to modify the immune response provides some promise for people looking for new strategies to control their symptoms. As always, consult with a healthcare practitioner before beginning any new treatment plan. Next, learn how to take baking soda at night for health advantages, including the proper amount, timing, and duration. Using baking soda as a natural health tool combines simplicity and science. But time, dose, and safety are more important than anything. To begin, the best time to consume baking soda is 1 to 2 hours after your last meal, just before bedtime. This helps your stomach to settle and lowers the danger of acid building overnight, which is commonly the source of discomfort, especially in situations of arthritis-related inflammation and acid reflux. In terms of dose, most healthy persons believe 1/2 teaspoon, or about 2.5 grams, dissolved in a glass of cold or room temperature water, 6 to 8 ounces, to be safe for occasional usage. Stir until entirely dissolved, then sip carefully, without chugging, so your stomach can absorb it without becoming too bloated. Now, let us discuss duration. If you're looking for anti-inflammatory benefits, such as rheumatoid arthritis support, to observe tiny changes, you will need to utilize it for at least 2 weeks on alternate days. However, long-term daily use is not recommended without medical supervision. Due to dangers such as high sodium intake, alkalosis, or intestinal imbalance for overall well-being, 1 to 2 times per week may be adequate and far safer in the long run. Be mindful when using this. This simple kitchen item can become a silent ally in your nighttime wellness regimen, as it did for Maria. Small dose, large impact. Next, who should not take baking soda at night? Know the risks before you take a sip or go for that tumbler of baking soda and water. It's important to understand that this cure, while natural, is not safe for everyone. People with high blood pressure should exercise additional caution. Baking soda is heavy in salt, and even little amounts can elevate blood pressure or exacerbate heart problems if consumed consistently. If you are on a sodium-restricted diet or take drugs such as diuretics, corticosteroids, or antacids, baking soda may interact with or intensify their effects. This can disturb your electrolyte balance, resulting in muscle cramps, weakness, or even alkalosis, a condition in which the blood becomes too alkaline. Pregnant women should not take baking soda as an antacid or treatment unless their doctor approves. It can cause fluid retention and raise blood pressure during pregnancy. People who are prone to stomach bloating, gas, or gastrointestinal discomfort may find that baking soda causes more harm than good if used excessively. When it combines with stomach acid, it produces carbon dioxide gas, resulting in a bloated, gassy feeling. Also, if you have a history of heart illness, particularly congestive heart failure, avoid clear, because the increased sodium might increase the burden on your heart. Bottom line, baking soda is not a cure-all. What helps one person sleep better or feel less irritated may hurt another. Always consult with your healthcare practitioner before beginning, especially if you fall into any of the following categories. And that concludes today's video. Now it is your time. Do you use baking soda water at night? If so, we would love to hear from you. Have you noticed a difference in your health? Maybe better digestion, less inflammation, or better sleep? Whatever your experience is, share it in the comments, and let's start a discourse. Your story might help someone else on their wellness journey. And hey, if this video was helpful, please put yes in the comment box. That one word may appear small, but it seriously drives us to continue producing science-backed health information like this. Please remember to like, share, and subscribe if you haven't already. Your support means everything, naturally. Thank you for watching, and as always, stay healthy.